As a beginner, one of the things that you can do to start engaging those pelvic floor muscles is actually doing them while you're laying down. If you can prop your knees up, what that does is it takes away your ability to use those accessory muscles. So, but you don't want to tilt your pelvis. That's one of the things I always tell people. So lay on your back, prop your knees up, and close your eyes if you want to. And again, just imagine that vaginal opening being pulled up towards your belly button, you're again squeezing your finger if you've got something in there. The other thing that you can do, there are tons of vaginal weights out there, right? Now, we don't necessarily need to like squeeze a banana in half or anything like that with our pelvic floor, but when you have something in the vagina, it's again a direct correlation to help censor your brain to say, okay, there's something in there. And then you can feel it. You can feel it move up, you can feel it move down. So there are weights out there that weigh nothing and essentially just have something into the vagina that can make it much easier for you to assess that, especially if access to, again, placing your finger vaginally is not always the case. But that's a great way to start as a beginner. One of the ways that you can prepare your pelvic floor when you are getting ready to give birth is to do some deep squats. We have to remember that there is this big old baby that's about to come through this very small, tiny space, right? Now our bodies are very much designed to do that, but sometimes they need a little bit extra help. So deep squats really help to open up those pelvic floor muscles so that you get more lengthening in those so that they are ready again to have a vaginal delivery. We have to remember though that sometimes women don't always give birth that way, and that C-sections or cesareans are again a very common way that you can give birth to. But those pelvic floor muscles are still preparing you to birth that baby the good old vaginal way, right? So those muscles are still lengthening and still expanding, so we still want to be able to do those muscle squeezes. Sometimes those muscles are a little too tight, and so one of the ways that you can do that is with your thumb, can be really effective. So again, if this is your vaginal opening, you take that thumb and just lightly put some pressure there at that vaginal opening. It's just going to trigger those muscles to start opening and expanding, again, preparing for that delivery if that's the way that your baby is born. Healing the pelvic floor after vaginal delivery or even after a C-section, one of the best ways that you can do that is doing things immediately. So making sure that you are going ahead and engaging those pelvic floor muscles, you're starting to do those Kegels or those pelvic floor squeezes. Now again, I will caution you that sometimes women will have a tight pelvic floor after delivery. If babies come very quickly and your body doesn't have time to expand those pelvic floor muscles, sometimes they react in an opposite direction and tighten up. So making sure that you are listening to your body. If you're feeling pressure, tightness versus like a heaviness in the pelvic floor, that can sometimes mean that you have too tight of pelvic floor muscles. You can actually go see a pelvic floor physical therapist 2 weeks after delivery. So relatively quickly are some of those things that you can do. Avoiding constipation after delivery is going to be a really good one. Making sure that you're staying hydrated, that you're toileting properly is going to be important. Not straining is also another good thing to do in helping to heal that pelvic floor after delivery.